This is Krista. Welcome back to MadeToBeWhole. Stay tuned for our discussion on MCAS.
MadeToBeWhole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on MadeToBeWhole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing.
So I frequently get questions about MCAS, which, for those of you who don't know, is Mast Cell Activation Syndrome. It's a real thing, but it's also kind of trendy right now. And so people will get on their message boards or their Facebook groups and say, do you think my problem's just MCAS? Do you think I have MCAS? And it just depends. And I'll tell you, I think it matters a lot, but maybe not as much as some people think specifically. So MCAS is Mast Cell Activation Syndrome. Mast cells are a part of your immune system. They're normal and they're supposed to respond to certain insults, but MCAS happens when they over-respond, either too intensely, too frequently, or for too long of a duration. They can cause growth and development problems. They can cause a lot of inflammatory problems. They can cause allergic type symptoms. So some people with MCAS have this chronic inflammatory state, which is obviously going to be common with an infectious state, but they also can have flares of symptoms from time to time. So symptoms of MCAS, and when I say this, just think about how much this overlaps with so many of the other things we've talked about in this show, why we've got to do a little bit of differentials, but also broad picture, because just because you have MCAS doesn't mean all the other things that you found aren't an issue or don't need addressed. So if you have MCAS, it needs addressed, but that doesn't mean, oh, MCAS was what was really driving my problem, so I don't need to worry about my Bartonella anymore. Oh, MCAS is my real issue, so I am going to neglect treating mold illness. No. MCAS is triggered by those things, and you have to deal with the MCAS, deal with the syndrome, try to calm down the inflammation, but you still need to go farther back to what instigated it. So if you think of what chronic inflammation can do, some of the symptoms for MCAS, chronic fatigue, brain fog, tummy issues are common. That can include nausea, cramping, diarrhea, pain. You can get skin symptoms. Some people get flushing. They get redness in patches, different places, itching, swelling, hives. There can be swelling of the tongue and lips, almost an allergic type presentation, tachycardia, which is your heart racing, food intolerances, chemical sensitivity. So the person who's triggered by perfumes, cleaning products, anything like that, those can all be symptoms of MCAS, but those can also be symptoms of other things. So we just have to be really cautious with taking the time and investing the energy and resources to do the right testing so that we're pursuing the right complement of treatments. Because even if you have MCAS, which is a syndrome, which if you have listened to me before, I say BS, beware of syndromes. The syndromes are real. They can be a real problem, but they are just a group of symptoms that occur together. They do not identify root cause. Something instigates a syndrome. So you can do all the MCAS type interventions that you want, but you're going to be kind of chasing your tail if you don't still get to what started this fire. So I think that investigation is really important, and it needs to be kind of a broad looking at environmental things, mold, water, fumes, looking at infectious causes, looking at anything that could trigger this chronic inflammatory state, obviously allergies themselves. So what happens is you have the stimulus, the thing that starts the fire, whatever it is, and then your cells release cytokines, chemokines, histamine, proteases, these lipid mediators. And then those things go to work and they're going to cause increased mucus secretion in your goblet cells. So mucus is all over the place. You've got mucus in your nasal passages, in your throat, your respiratory tract, your vaginal tract. So you can have increased mucus secretion in any one of those places. You have these fibroblasts, so fibronectin and collagen get deposited. Your smooth muscle cells are going to constrict possibly. The endothelial cells are more permeable, meaning there's more leaking, so that can cause inflammation. You can have IgE production. So IgE is the type of immunoglobulin that is released. Typically, it's considered like the classic allergy type presentation. So if somebody has a true allergy to milk, they will have elevated IgE antibodies to casein. If they have a true wheat allergy, they will have IgE antibodies. But it doesn't mean that you don't have a problem or an allergic type problem if you don't find those IgE antibodies. It's just one indicator, and our allergy immunology community has gotten really, really strict about it. There's a book I mentioned previously. It's called Chemical Exposures, Low Levels and High Stakes by Nicholas Ashford and Claudia Miller, where they talk about this debate in the professional world, how some people cling to this IgE view of things versus looking at symptoms in the person and also IgG levels. So just so you know, the science isn't settled, and it's, in my view, never science if it's truly settled, because we're always seeking to learn. One thing that I think is interesting, I have had a few patients who have a really, really just total IgE level. Now, if their IgE is a little elevated and it's allergy season, say, and there's someone who has asthma and allergies, that's not unexpected, but there is something called hyper IgE syndrome. You can have this massive IgE excess that can cause all sort of skin problems, all sort of stomach problems, just craziness, almost being like in a constant near anaphylactic state. It's hard to breathe. They just feel terrible and cruddy. So that is a test that you can have run through your regular commercial lab. I like checking immunoglobulins. So the standard ones that can get checked to the hospital lab are GAME, GAME, with your IgG subclasses. Sometimes that gives us some clues about what's going on. If you have a deficiency of one of those, then that tells us, oh, they've got an immune deficiency. This is why this infection thing's not going well. Their body doesn't have what it needs to start it. Side rant, but IgE is something that can be looked at that, and it's your B cells that make IgE. It's your T cells that get the cytokines and chemokines going and release that. And as we've said, you can have symptoms kind of all over the place. Now, people want all the time to know, what's the treatment for MCAS? How do I treat my MCAS? And they want a treatment that's going to change everything. And it's not there for most people. It's usually a combination of things, and again, working to identify the root cause. If you are living in mold and you have MCAS, it is very, very unlikely that you are going to get better while you are still living in mold. So Dr. Colin Renaud, I hope I'm saying your name right, it's Renaud, but I heard him speak in November of 2024 at ILADS, and he talked about MCAS and mold and how chronic mold exposure, whether it be at home, work, even in your car, your immune response is on overdrive all the time. And then you've got this ongoing mast cell activation and these inflammatory chemicals, the cytokines and chemokines, that just keep getting overproduced, and you can have ongoing stuff. And he used the phrase that I hadn't heard before called a relocation sabbatical. So he said, when you're talking to someone that has MCAS or some of these other chronic things that you think might be environmentally triggered, one test is to have them leave the environment for a while. And if they feel much better, the home is the problem. The workplace is the problem. So if I have a patient who says, whenever I go visit my my mom in New Mexico, I'm fine. Or when I visited my brother up north for a month, my symptoms were massively, massively better. That is a clue. And what you need to do in those cases kind of depends on your situation. For example, if you rent, I would suggest moving out. I don't think it's worth fighting the battle because most landlords are not going to do anything about it. And your focus needs to be your health and getting yourself into a safe location. It's obviously different if you own your home. Yes, we've mentioned this before, but you can, in a new home or a new build, have mold issues. Look in the ductwork, look at what was used to build, and if there was anything that was stored improperly, that could have developed mold. Then those spores are in the house. He presented what I thought was a really fascinating case study because it was very close to my neck of the woods and the sorts of things that I have seen pretty frequently in my population. So this was in November 2023. He saw a patient, a 29-year-old Caucasian Amish female living in rural Pennsylvania on the family farm. So I'm in rural Ohio. We have a lot of Amish patients, and there are a lot of mold issues just because of the lack of central air circulation, the dampness, a lot of different things that not all of us deal with. So this woman came to his practice. She had chronic diarrhea. She couldn't tolerate anything, including most foods, medication, supplements, was getting diarrhea. She had insomnia. She had food intolerances. She had chronic fatigue. There was only one type of bottled water she could drink without getting diarrhea. Even the smell of food could trigger diarrhea. And she had lost 70 pounds in a year. She was started on TPN, which is total parenteral nutrition, which is when you're getting all of your food into a vein through either a PICC line or a port. But she started having allergic reactions to the TPN. So when he came to her, she had only been eating white rice, but there were days when she could only eat coffee. So for 3 years, she had had this super, super restrictive food intake. He went to her history. She had grown up in rural Pennsylvania on the dairy farm. So what do you have on a dairy farm in addition to cows? You've got cats, dogs, horses, goats, hens, rabbits, parakeets, all of the above. Outdoor cats are a big, big vector for Bartonella. She had been scratched by outdoor cats multiple times. She had a younger sister who was formally diagnosed with cat scratch fever, which is that acute Bartonella henselae. In 2008, she had an embedded tick on her chest. In 2008, she also moved into the home she was living in at the time that she saw him, and there was visible black mold throughout the house. It was an old house built in the 1800s, and the surrounding farms were treated regularly with pesticides. She also had mold exposure where she worked. The work had been remediated. So she had seen another physician for a workup for MCAS, and he had made a formal diagnosis because she had this clinical history that was completely consistent. Plus, she actually had elevated plasma and whole blood histamine levels. You can have MCAS and not have an elevated histamine level from blood work, but it's always nice when we have something like that. And she had actually had a polyp after she had a colonoscopy that they found higher levels of mast cells in. So there was a clear clinical and laboratory diagnosis. She had also had endometriosis, gallbladder out, thyroid cancer, pancreatitis, all sorts of stuff. She was taking Claritin and Tagamet, which are antihistamines. And with her PICC line, she was taking IV Benadryl 4 times a day, sometimes less, 2 to 3, up to 4 times a day, just so she could eat. That was the only thing that would calm the inflammation down so she could eat anything. She was on thyroid medication, took some CBD for sleep, but in really, really rough condition. So her regular hospital labs, other than that histamine, were pretty okay. You know, she had low vitamin D, low vitamin B6, but that's not going to cause the severity of those symptoms. It needs addressed. They did the urine mycotoxin testing, and she had elevated levels in all of the categories of mycotoxins, which is mold. They did the beautiful fish testing that I love from T-Lab. She was negative for Lyme disease, but significantly positive for Bartonella and Babesia. They did that BNR panel, the bright field microscopy blood smear that shows you biofilms and coagulation. And she had some really nasty looking stuff there showing significant biofilms. She had some abnormal stool testing, but what it comes down to is she was really, really sick. She had her initial consultation. She was coming back multiple times because of fatigue, pain, fainting, low O2 sats, racing heart. She was still using the IV Benadryl. She was given some liquid mast cell stabilizers. It helped her diarrhea a little bit. It made her heart race even worse. She discussed getting the things she was taking compounded. And she also said she thought even what was in her IVs was causing a reaction. So the doctor looked and they found out that the infusions were going through a line made with what's called DEHP. So he had her sent supplies that didn't have that. But she had noted in her initial visit that she had spent some time in Colorado for a couple of months a few years ago and felt much better out there. She had family out there, felt much better. So he recommended this relocation sabbatical because you've got, besides the fact the mold in her house, he's looking at, okay, there's pesticides living on the farm. All of that's going to keep you from getting better. And I will tell you, it's so hard to tell people, but a lot of these rural communities, you think you're in this really healthy, great environment. But if you've got fields being sprayed with pesticides, it could really hijack your health. And it's really, really a problem. I've seen it affect multiple people. So she messaged him and said, I had to tell you something exciting. I used a 500 milliliter bag of fluid. It didn't have any side effects. My mind is blown. I just can't believe I'm feeling better. A month later, she said, I'm back in Colorado. The difference is unfathomable. The last day at home had my family terrified. She had 13 doses of IV Benadryl and is still coughing nonstop. That was 1 week ago. She's only had 1 dose of Benadryl since then. She used it as a pre-medicine before hanging out with friends in case she breathed in anything. They were the people who wear like fragrances can really trigger stuff. But she said, it's incredible to be able to breathe without feeling like I'm suffocating with every breath. Thanks, doc, for giving me the best prescription ever. So she stayed out there and she's still living in Colorado with family and told him she's the most stable that she's been in years. No more episodes of anaphylaxis. She had at least 2 of those a week when she was living in Pennsylvania. She is not needing her IV Benadryl. She still is on a strict diet that's helped her acne, her diarrhea, her nausea. But she said, quote, I feel like I have control and power over my body now, which I've never had before. So that is amazing and miraculous, but it is a really hard pill for people to swallow, that their environment could be part of what's making them sick. I'm not suggesting everybody needs to move to a different state, but I am suggesting look for clues. If you feel better when you travel, it's probably not just stress. There's probably something in your environment that's affecting you. I think the cheapest place to start versus getting your home tested is to test you. Both Mosaic and Real-Time Labs have urine tox screens that include the mycotoxins, which are the mold, plus other environmental toxins. I've mentioned before, my son Gideon had really elevated levels of benzenes in that, which we were looking for because of his genetic testing. So that's the easiest way to start. And then if you have mold, don't put your hand over your ears and close your eyes and go, la, 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 la. It can't be my house. It can't be my house. It can be. It absolutely can be. And if it's not, you want to rule that out and know where else to look. I was talking to another practitioner who had a patient who had mold, and they finally figured out that it was his car. He spent a lot of time in the car traveling, and he had left the sunroof open, I believe the story was, multiple times. It got wet, damp, mildew. There was mold in the car, and that's what was making him sick. That's a lot easier than getting rid of your house, but it's still, you need to figure it out. You need to let go of your pride, take a deep breath, and fix your environment, because you're not going to get better if you can't. Now, if the tests rule it out, then forget about it, because the other issue that I see some people have is they're so convinced that even though they've had their home tested and their urine tested and there's no mold anywhere, they're just convinced that it must be mold that's keeping them from getting better because they have all the symptoms. Now, one or two of them might be right, but think about the symptoms of mold toxicity and how they overlap with so many of the other things we've talked about. Think about how, in the last 2 episodes, we've talked about MCAS and long COVID, both of which cause chronic fatigue, brain fog, stomach issues, chemical insensitivities, and food tolerances. There are a lot of potential causes for this type of presentation. And I think it's well worth investing, even though it's exhausting. It's absolutely exhausting, but you've got to figure out what's going on in your environment and you've got to just fix it. So the other thing I wanted to mention was how genetic testing can help us figure this out. So I've talked before about Intellix DNA. I love this test. It's functional genomics, which is looking at your genes and how they make you more vulnerable to things, but then everything they include in their test is linked to research that helps us know what we can do about it. There are no hopeless positives in this test because absolutely everything that's included in their panel is linked to research and is actionable. So one of the panels in the test, it's this mast cell and IgE panel risk SNPs. SNPs are, again, that single nucleotide polymorphism, which just means your genes, okay? So they're looking at, do you have any vulnerabilities based on your genes? And if you do, what research is there that tells us this is the way to take care of it? Because all mast cell presentations aren't going to respond to these same things. Kind of like the low-hanging fruit that anyone can try are your over-the-counter antihistamines like loratadine, which is Claritin, and Pepcid, which is famotidine, or quercetin, which is a supplement. But again, DNA testing comes in handy too, because if you have this specific gene, it's a COMP2 variant, especially if you have 2 copies of that, then quercetin can actually make things worse for you. So worth finding out. But going through this panel, so there's one of these inflammatory cytokines called interleukin 13. If you have 2 copies of this gene, you're going to have a much more likelihood to have a prolonged inflammatory response and allergic responses and allergic diseases like asthma, COPD, that sort of thing. So we know, okay, there are specific things that have been shown to help this. We know that they're like Xolair is a medication that inhibits binding of IgE to the receptor. We know on the supplement side of things, quercetin decreases the production of interleukin 13 if you genetically, that's a good fit for you. There are a whole list of things, and then it also gives me the studies to look at it. There are a couple of different pathways that affect interleukin 13. They also look at interleukin 4. So interleukin 4, again, it's a cytokine, an inflammatory molecule that your mast cells make. When your mast cells make interleukin 4, then you've got this whole allergic cascade that starts and makes the interleukin 13 more likely to be produced. So it's just the domino effect. So if you have that genetic vulnerability, there's actually evidence on some other things like black cumin, N-acetylcysteine, and then we look again at a list of supplements, and we're always trying to match it up. The interleukin 4 receptor variant, so you have interleukin 4, but then everything in our body has a docking station. So when somebody has this interleukin 4 receptor variant, the G variant, they're much more likely to have these ongoing allergic responses. But I have here some overlapping interventions with the other genes, but some of them that are unique that could help a person who had that. We know in people with that variant, montelukast, which is singular, might be an appropriate thing to try. So I could go on and tell you the names of all these genes, but this isn't school. You don't need to know that. All you need to know is there are a lot of different genes that affect IgE levels, IgE binding, that affect this inflammatory cascade with mast cells, with cytokines and chemokines. And there's actually a way to identify not just the levels of those things, there are some laboratory tests of that, but more importantly, how your body is going to respond. So ketotifen is something that you'll hear about fairly commonly in the MCAS space. And ketotifen is a mast cell stabilizer. It can be compounded for people, but there are certain people who that's much more likely to work for. So I would much rather know, based on your genes, ketotofen's not a bad intervention. Why don't we start on that versus someone else? It may not be the best starting place, and I can do something more targeted. So I'm sure there's a part of you that probably feels like, wow, the more I get into this functional integrative space, the more Krista tells me about tests and expensive tests. And I do love my tests, but I love tests because guessing is expensive too. And if you really want good individualized care and optimized outcome and shorter recoveries, we can't promise short recoveries because healing takes time. And somebody who's chronically ill, you have months, years, maybe even decades of things that led you to this point, but it will take less time if we can figure out what's going on in your body. What are you vulnerable to? What interventions are going to be most appropriate for you? And then we have this as a reference to just keep going back to. Thankfully, now in our Foundations of Healing program, the toxin screen is included. So that includes the urine and environmental mycotoxins, urine, mycotoxins, and environmental toxins. Plus, it also looks at glyphosate levels, which can be a big deal. And I think it's just a great shortcut. It seems like, again, one more test, but you want to rule that in or out straight up. You want to rule it in if it's happening, but if it's not happening, then you can let it go and not hang it over your head. And you can look at what other things might be driving your flushing. Could it be a vasomotor thing because you're more prone to hot flashes because of hormones? Could it be this is really babesia that's driving this and it's not a mast cell or allergic type response? So take a deep breath. Don't be afraid to look at your environment because it holds the keys to a lot. We're living in a modern age where we have so many advantages, but we're also exposed to a lot of garbage that people weren't before. And we have to be mindful of that. And we have to look at how it's affecting us. And that's one way to take control on your journey to wellness. Remember to have hope because you were made to be whole.
Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.